Cabinet meeting, and then hand over to Minister Donohoe and Minister Zappone to fill you in some more detail on some of the issues under their brief. First of all, a number of routine matters, as there often is on the agenda, a couple of appointments and some annual reports, a progress report on the implementation of the financial services strategy for Ireland, where we've exceeded our target of creating 10,000 additional jobs in that sector, an expansion of the Garda Liaison Officer Overseas Network, so appointing Gardaí to Washington to cooperate with police authorities there and in Canada, and also to Bogota in Colombia for cooperation with Latin American countries. We agreed to extend the temporary provisions amending the Civil Registration Act. As you know, at the moment, it's not really possible for people to appear in person before the registrar to register births and deaths, so that those temporary provisions were to expire at the end of May, but now they won't. They'll be extended until the 31st of August. We also extended the application of Section 12A of the Redundancy Payments Act 1967, so that relates to redundancies that occur during this pandemic period. The Taoiseach gave us a detailed update on Brexit. As we all know, Brexit hasn't gone away, and talks are intensifying at a European level with a view to an EU-UK seminar next month in June. So very little progress in reality being made on those talks, but often that's the way talks go. You sometimes have to have a crisis or a breakdown before you come to an agreement or a solution, but that's a very live issue at the moment, and while the government is prioritising COVID, we haven't forgotten about Brexit either. And among the things we agreed to do was to continue to step up no deal planning. That's no trade deal planning in case we get into that position at the end of the year. We of course have a deal on the Irish specific issues, but we don't have a deal on trade. So when we talk about no deal these days, we talk about no trade deal. It's a different no deal than the one we talked about a year ago. But we need to step up planning for a no trade deal scenario, and as well as that gave approval to the Department of Foreign Affairs to begin drafting new Brexit legislation. We have the Brexit Omnibus Act, which went through last year, but we're going to need new legislation for the next phase of Brexit. It'll be another big piece of legislation, and drafting on that has now begun in the Department of Foreign Affairs. As you can imagine, the main focus of the meeting, more than half of it was spent on COVID and our national response to that. I think when we talk about COVID, it's always important to acknowledge that over 1,500 people have now died as a consequence of COVID in Ireland. And while we talk about things going in the right direction in terms of new cases and the number of people in ICUs, the number of people being hospitalised, we should never forget that there are still thousands of families in Ireland who are grieving for people who have lost their lives as a consequence of COVID, and also very many people who are very sick, who might be on the mend, but have not yet fully recovered. Having said that, we had a look at the numbers, and it is reassuring to see that the numbers continue to go in the right direction. We never look at any one day, because you can have spikes on any one day. We look at a 5-day rolling average or a 7-day rolling average, and that's all going in the right direction in terms of new deaths reported, hospitalizations, the number of people in ICU with COVID, the number of new cases being reported. So in accordance with the plan to reopen Ireland's society and businesses, we'll look at the data again next week. The reason why we set this 3-week reference period was because it takes at least 2 weeks to know if the actions that you took to ease restrictions are having an effect or not. So we only eased restrictions for the first time on the 18th of May, and it's really going to be next week, when we see those numbers next week, before we can determine whether we can move to phase 2 and whether we can have any confidence about bringing forward some of the actions that are in phase 3 and phase 4 and so on. So we'll do that at a cabinet meeting next Friday, having looked at the numbers, having consulted with various different sectors, and also having considered new advice from NEFID, which we'd expect to receive next Friday. But we are on track to move to phase 2 as intended on Monday the 8th of June. Minister McHugh presented a memo to us on reopening schools, and he confirmed that it is the intention of government to reopen our primary and secondary schools at the beginning of the school year. The school year, as you know, begins at the end of August. not September. So it is intended to open primary schools and secondary schools at the end of August, at the normal time that the academic year begins, and they're making good progress towards that, particularly paying attention to new and emerging research about the level of risk attached to schools being open. And as the research continues to come in, we know that it's not a no-risk scenario, but it is a low-risk scenario to open schools. And in addition to that, are learning very much from the experience of other countries that have opened schools at least partially already. We're also learning from the experience of countries that have had to reimpose restrictions. And as you know, there have been outbreaks in schools in France. I heard today that 200 schools in South Korea have had to be closed and moved online because of outbreaks there. So we're aware of that too. But we're certainly working towards that target, which we believe we will achieve, of opening primary and secondary schools at the beginning of the new school year at the end of August. That might not mean that every student is able to return every day for the full day, but our objective is to have things as close to normal as is possible. He also updated us on proposals for a summer education programme for children with special educational needs and other special needs, and he's making some good progress on that. It will be voluntary, but certainly for parents who want their children to be able to avail of it, we're making very good progress on being able to put something in place in July and August that is specially put in place for children with special needs. Mr. Zappone, and she briefly on this earlier, gave us an update on the phased plan to reopen childcare services starting at the end of June. And Minister Harris brought forward a memo on the private hospitals. As I think everyone knows, the state took control of the private hospitals in May because we wanted to make sure that we had adequate ICU capacity, adequate critical care capacity and adequate bed capacity, so we wouldn't see the scenes that we saw in other countries where hospitals became overwhelmed, where there weren't enough ventilators, as was the case in America, for example. Thankfully, we never got to that point because we as a society successfully managed to suppress the virus through our actions as a nation, and we didn't need to use the private hospitals to the extent that we thought we might. We very much stand over the decision to take control of the private hospitals back in March. It was the right thing to do, and we have made some good use of them since then, but certainly nothing approaching the level of use that we thought we might have required back in March or February. So under the contract that we have with the private hospitals, it runs until the end of June, but we have to indicate to them today as to whether or not we're going to extend that as we can. So we are indicating today to the private hospitals that we're not going to extend the contract beyond the end of June, but between now and then we will negotiate with the private hospitals a new agreement, and our objective in that new agreement is to have step-in powers, if you like, or step-in rights to take control of ICU beds and critical care capacity and other beds if we need them, if there is a second wave that is worse than the first one, or if we find that a second wave of the coronavirus coincides with a bad flu season in the winter. So we want to be able to step in and use that critical care capacity in the private hospitals if we need it. And the second objective is to come to an agreement with the private hospitals, similar to what we have already through the NTPF, to use their facilities to provide health care for public patients, because as you know, there's a growing backlog of people waiting on operations, waiting for outpatient appointments, waiting on scans, and we may need to use that additional capacity that they have in the private hospitals for public patients, as we've done in the past, but perhaps in a better and more different way. Finally, two other memos brought forward by the Minister of Finance, so I'll let him talk to you about them, and they related to maternity leave and the temporary wage subsidy scheme, and also the European Investment Bank's Pan-European Guarantee Fund and the EU SURE instrument. So over to you, Paschal.
Thanks very much, Taoiseach. Good afternoon, everybody. As many of you will be aware, the temporary wage subsidy scheme is one of the most significant measures that have been introduced since the start of March. The objective of it was to minimise the effect of this pandemic on jobs and income, to give companies a fighting chance of keeping people in work, or to allow employees to continue to keep the relationship they have with their employer. This scheme to date has had a really significant impact in keeping people at work, keeping companies going, and as I said, giving a pathway for those who may not be working at the moment to return to work in the company they worked for. To date, over 50,000 employers are now participating in the scheme, and we now have well over 400,000 employees participating on the scheme with their employer. The scheme, as you know, provides a subsidy from government to cover a portion of the employee's wage bill in circumstances where the employer's business has been severely affected by COVID-19. And shortly after the introduction of this scheme, the government and I became aware of an anomaly where certain employees whose personal circumstances related to either maternal or paternal leave meant they weren't able to go back on the payroll via the wage subsidy scheme. So my own department, together with the Revenue Commissioner, have been looking at a number of ways to address this issue in a way crucially that ensures consistent treatment with other employees who were on the payroll in January and February. And as a result of this work, the Cabinet today agreed an important change to the scheme to ensure that workers are not denied access to it because of their personal circumstances relating to maternity and paternity leave. So I'm now pleased to confirm that a change to the scheme has now been made to accommodate the salaries of those who have returned to work after a period of adoptive or maternity leave and who therefore were not on the payroll during the relevant period. The amendment will be legislated for later in the year as part of the usual finance bill process, but in the interim, the Revenue Commissioner have confirmed that this provision will be implemented with effect from the date of the commencement of the wage subsidy scheme from March the 26th. And the government is making this important change because we want to ensure that citizens are not denied access to the scheme because of their personal circumstances at the moment in which the scheme was introduced. We're recognising the very unique circumstances of those who are returning to work after a period of maternity or adoptive leave, and we are doing this crucially by allowing equal treatment with other participants on the wage subsidy scheme. Technical details of how this will be implemented will be published by the Revenue Commissioner this afternoon, but I do want to highlight to employers that a manual process will be adopted. It will require input and information from the employers, and I would encourage them to contact the Revenue Commissioner as soon as possible so that we can ensure that those employees who are not able to enter this scheme for those reasons will shortly be able to join us. Thank you.
Thank you for being here, everyone, this afternoon. This morning, the government discussed our plan for the phased reopening of early learning and childcare centres. Children and families, of course, are at the heart of our plan. The reopening of the childcare will be as child-centered as possible. Their well-being, their happiness, their ability to play with their friends again, that's what we're really focused on here. We're tiptoeing, of course, towards something resembling our pre-COVID lives, and I'm deeply conscious that in the past 3 months, it has been tough on children. They've missed playing with their friends, hugging their grannies or granddads, and the freedom that we all took for granted. So going back to early education and childcare will be something at one level that they're looking forward to, but maybe a bit strange for them too, moving away from their parents for the first time in 3 months. And so that's why we want to do our best to reintroduce some familiarity into their lives. We're recommending that as far as possible that children return to childcare, go back to the creche that they were in pre-COVID-19. Familiar faces, familiar places. This is what will help children settle in to their new routine. It'll be different from what they left in March, but having their friends around them once again, we believe, will make it less strange. And I think that parents will feel more comfortable placing their children in the care of practitioners and professionals that they know and have come to trust. All the stress that's been associated with the restrictions, it's important that children are returning to contexts where they feel comfortable and that they know they can be happy. Many of you have probably heard a little bit about play pods already. I know many parents of young children are familiar with that concept. We're introducing that concept, that practice of play pods, to keep children as safe as possible. We know that young children can't do social distancing. And older children cannot do social distancing in a play context, as we have in our school-age childcare settings. So it's my belief that play pods will allow children to play in a natural, spontaneous, and creative way. I am very, very pleased that the guidance from the Health Protection and Surveillance Center indicates that the size of the play pod can be in line with our childcare regulations. For example, for children in full day care, this means that for children under the age of 1, there could be 6 children and 2 adults in a play pod. Or for 2 years old, there could be 12 children and 2 adults in a play pod. The full details of the guidance is being published on the HPSC website this afternoon. I think it's probably up already, and it will also be available on the Department of Children and Youth Affairs website as well. But you know, during this time, parents have been the champions. The one location is their home, their workplace. Their children have become their pupils. Their lives have been a treadmill of parenting, caring, working, entertaining, worrying, and much, much more. But despite this, some of them will be anxious about their children leaving home and returning to childcare. And you know, I think that this is understandable. There is a risk. Every time we ease restrictions, it will bring a risk. But we need to weigh up this risk against the risk of children not returning to early education and childcare. Every family is different. Every parent will make a decision based on what is best for their child and family in making those decisions. But in a survey conducted last week on behalf of my department, a proportion of parents reported concerns about their children's health as their primary reason that they are no longer planning to return to center-based childcare, particularly in the summer months, though perhaps then in early September. What I want to do then is to recommend to all parents to take the time to read that public health advice that's been published, that's contained, which contains guidance for what's going to happen in the childcare settings. It's inevitable that there will be a transmission of virus in settings at some time, but the guidance provides us with the best way to reduce the risk of infection, to prevent it, and our childcare practitioners are professionals in that anyhow. So I want to say at this stage too, though, it's not possible to say how many childcare services will reopen in July and August, and so therefore what the capacity is. Many of them are usually closed during those summer months. But childcare providers asked that I would publish the public health guidance 4 weeks in advance of opening so that they could get ready. And we're doing that today, and we're a little ahead of time. So I hope that it will allow them to begin to assess how many children that they can take in. They're very familiar with the existing regulations, which sets out the ratio in terms of the numbers of adults to children of various ages. So I hope that many will be reassured that the play pods are consistent with those regulations. But what I really, I suppose, especially want to say today is that in order to provide clarity and certainty for parents and providers about the numbers of children returning to childcare, I want to strongly encourage both parents and providers just to reach out to each other from now on, find out, what will be happening in your child center and the availability of places from June 29th or in the later phases. We still, though, just to conclude, we still have some unknowns. But I feel that we've taken a major step forward on our pathway to reopening early education and childcare settings by publishing this public health advice. That's the foundation upon which provides the safe return for our children to early education centers. And subsequent to that, we will determine then the capacity and the number of places that will be available in the early phase. Look a little bit more again about the demand from parents, and then calculate. We have to do a little bit of work with my friend there on the left, Paschal, Donohoe, Minister for Finance, in terms of the funding model that will support this as it reopens. But for the sake of the children, their families, and our economy, I hope that childcare will be available to the greatest extent for the parents that need it as they try to get back to work. It's a national effort. The Trojan efforts of our frontline workers, the sacrifices of our people have gotten us this far. And so I know that all of those who can play a part in getting us to the next phase by helping to protect the livelihoods of families and restarting our economy will do so.
Taoiseach, do you think there's any possibility, as Fianna Fáil's Thomas Byrne suggested today, of schools fully reopening in late August and September? And just on that issue too, you're probable, we could even say at this point, government partners, few potential partners, seem to be advocating a more accelerated approach around easing restrictions. Could that pose a difficulty in a few weeks' time? And just to Minister Zappone, will there be increased inspections, or will that be necessary to implement that PlayPod plan?
Okay, so provided the virus doesn't make a comeback between now and then, primary schools and secondary schools will open at the end of August, at the start of the new school year. It may not be possible for every pupil or every student to return for the full day every day, but that's the point we would aim to get to. So, you know, it may be necessary to phase in the reopening, if you like, of primary schools and secondary schools, but our objective is to open them as fully as is possible, as soon as is possible. And again, provided the virus doesn't make a comeback, primary schools and secondary schools will open at the end of August for all kids, which is at the same time as the normal school year. You know, in terms of accelerating the reopening of the country, you know, I think the vast majority of people, including the government, would like to see us accelerate the plan to reopen the country. But I have to caution that as well, because if we do that, we have to do that based on data and based on us being sure that it's safe to do so. And we only eased the restrictions on the 18th of May. And if for some reason that has caused the virus to start spreading more rapidly again, we won't know that until next week. So I think making any decision today about accelerating the reopening of the country would be premature and would be risky. It's something we can only really consider next Friday when we have more advice from NPHET and we see whether the easing of restrictions on the 18th of May has caused the virus to propagate again, and we won't know that until next week. And you know, I talk to people all the time who are keen to get back to work, who want to open their restaurants, open their bars, restore domestic tourism, do all the things that we all want to do to get normal life going again and get the country going again. But I think the worst thing we could do is to reopen businesses and then 2 or 3 weeks later tell them they have to close again. You know, I'd rather have a slow and steady plan that we accelerate safely than one that we accelerate unsafely and end up having to lock down again. Because I think nothing would do more damage to economic confidence and to national morale and to confidence in the public authorities if we told people it was safe to reopen and then told them 2 or 3 weeks later that all of a sudden it wasn't. So we're going to stick with the plan.
Yes, Michal, thanks for that question. You know, one of the most positive things about the last month and working with Professor Martin Cormican and other members of the HPSC is that they were very happy to collaborate with officials from my department who, of course, understand early learning and childcare and understand then the ways in which would be the importance of the practical application of the public health advice that would be developed. And so through that collaboration, my officials also worked closely with TUSLA, who is the independent inspectorate for early education and childcare settings. And TUSLA has been very, very clear that they want to be as flexible as possible in the implementation of the inspections as we move forward in these pandemic times, but there would not be any increased inspections. But I'm happy to say that they've been part of the collaboration with the health experts and also our officials.
Taoiseach, on the arrangement with the private hospitals, is there any clarity yet on how much the private hospitals are proposing to charge the state for the duration of the 3-month contract that was drawn up? And is it going to be the case now that because that arrangement will end at the end of June, that people who were patients of private consultants will be able to resume whatever treatment they were getting there? And to Minister Zappone, can you just again restate exactly how big a pod can be for children of different ages? And also, can we take it from what you said about your engagement with Minister Donohoe that there isn't any clarity yet on how creches will fund the shortfall, because obviously they won't be returning with the same population that they previously had, so is there still no deal there? And also, will there be any capital grants for childcare providers to install whatever partitions they might need to reinforce those pods?
Okay, just on the contract, I might defer to Paschal because he's probably more expert on the detail of the contract than I am. But the way the contract with the private hospitals was structured was on the basis that private hospitals wouldn't make a profit out of it, but we would cover any costs that they incurred, including staff costs, and that was the basis on which the current contract is agreed. What we want to move to after the end of June is a new contract that allows us to step in again and take control of ICU beds and critical care beds and other beds if we need them, and also in the meantime pay per item, if you like, for work done for public patients in private hospitals that needs to be done. Sorry, the second part of your question. Well, private consultants in some circumstances can already treat their private patients, and many are, and some are doing it on a pro bono basis. They're accepting the contract from the state, being paid €4,000 a week, which isn't a small amount of money, and treating their private patients on a pro bono basis. Some have decided not to do that, and that is their choice. What we do expect to see at the end of June and through the course of June is normal healthcare beginning to resume in our private hospitals and our public hospitals. But there is something to bear in mind. There's an impression being created that there is a whole load of work, a whole load of operations, a whole load of scans, a whole load of appointments that would have happened in the private hospitals in the past few weeks had it not been for this contract. And that's actually misleading. Part of the actions that we introduced when the country was locked down was to put a stop to non-routine healthcare in the public and private hospitals. We weren't going to bring in patients into hospitals that had COVID in them unless it was necessary. So the reason why we have spare capacity today in our public hospitals and our private hospitals is because routine healthcare was deferred because of the COVID emergency. And I think some people have created a false impression that the private hospitals would have been full had it not been for this contract. That is not correct.
I didn't answer the questions, excuse me. Okay, first question, in terms of the public health advice, there is no evidence base effectively on which to define a maximum pod size. At the same time, there's the encouragement that there is small as is practicable in that context, and to follow the ratios that are part of the regulation. So you asked the question, for example, for 1 to 6, for 2-year-olds, we could probably have 2 to 12, and then according to the regulation to keep the ratios, but to keep them as small as possible and every childcare setting is different, obviously. Secondly, we are very aware of the fact that there will be additional costs in relation to reopening, and I've been in discussions with many representatives of the sector over the last month and will continue to do so. We are examining some capital grants in that regard. And thirdly, in terms of your question, the next number of days is when we're going to be focusing on the funding model. We needed to have the public health guidance first. That's just come in to look at issues around capacity and demand, out of which that model will be developed in order to ensure sustainability. Of course, we're aware of the wages issue too, but particularly as well that the parental contribution will certainly remain at pre-COVID levels in the early phase.
Taoiseach, several weeks ago you said that one of the safest things to do would be to reopen schools as early as possible. Now it's been put back until September. There are countries like Norway and Denmark where schools are being opened much earlier and almost back to a full schedule with no increase or apparent increase to date in terms of the OR ratio. Could you just maybe outline the mixed messages in relation to August, September and the extent to which schools will reopen? How quickly do you think that schools will return to what would be constituted as a normal situation where all pupils will be in a position to attend? And secondly, you referred to Brexit legislation. I believe there's also EIB legislation that needs to be passed by the end of June. Are there going to be difficulties in the absence of a new government for your administration to tackle issues such as Brexit and the challenges it poses in the absence of legislation between now and the end of June?
Okay, well just on the question about legislation, as things stand here today, there is no legislation that we need to get through the Dáil and Seanad. Indeed, legislation has to go through the Dáil before it has to go to the Seanad, so we're not at that point at the moment. But there are items of legislation that are starting to mount up. One, for example, would be the renewal of the Offences Against the State Act, which would have to be done at the end of June by the Dáil and Seanad. Another is the EIB legislation, which you mentioned, for the Sure Fund. So we will come to the point at the end of June where we will need the Seanad to be constituted in order to get that legislation through. So that really is developing, if you like, as a hard deadline for the formation of a new government. or we have to look at alternatives, and they're very difficult, as you can imagine. Just in relation to schools, just again to point out that when we published our plan to reopen society and business, we indicated that schools would open at the beginning of the new academic year, which is the end of August. So there's been no change in that regard. That was always the plan from the day we had a plan. Other countries are different. Norway is much less affected by this virus than we are, so their circumstances are different. Sweden has adopted a different approach where they never fully close schools, but they have had a much worse experience than we have with the virus. So, every country is different and has its own context. In Denmark, for example, primary schools and secondary schools tend to be co-located, so they've been able to open the primary schools, not the secondary schools, but use the buildings of both. That's not really an option in an Irish context. So, different countries are different. But as I said, the plan that we published some weeks ago to reopen the country said that primary and secondary schools would open at the beginning of the new school year. That's the end of August. That's what's going to happen. It will have to be phased in, but as soon as it's possible, we'll have every kid back in the class.
Thank you. I just have a couple of questions. I might ask them just back and forth because they should be short enough answers, if that's all right. And Taoiseach, just to go back to Gavin's point in relation to the hospital deal, given that the hospitals are now, private hospitals are going to be free from the end of June, do you see a date when regular service can resume? Do you have an idea of that? A lot of talk this week about cancer screening, for example.
Yeah, there's no exact date. What we'll see, and it's already underway, is the restoration of normal health services. It's not just going to be flicked back on like a switch. It'll be phased back in. As you know, some things never closed. Emergency departments have always been open. Maternity and paediatric services have largely continued, as you'd expect. GPs, pharmacists have reopened. So you'll see a phased return of normal health services. But obviously the most important ones are going to be treating patients who have symptoms now. And we remain worried, that there are patients who have unexpected weight loss, have chest pain, a lot of worrying symptoms. I won't go through them all, and they should seek healthcare now and not wait.
Minister Donohoe, you said that the wage subsidy scheme for those in maternity is going to be backdated to the start date. Does that mean that people who have had someone on their books, say since April, to return to work, can they get back the money that they've paid out?
Yes, and what they'll need to do is contact the Revenue Commissioner and supply the information in relation to that person.
Okay, and finally, for either of you, whoever wants to take it, you both said that you would hope that a deal on government to be done by the end of the month, unless you're going to pull something out of the bag in the next 2 days. It's not. Where are we in it? When do you think we'll get a programme for government?
Well, I had a very good meeting with Micheál Martin and Eamon Ryan this morning. The talks are progressing. As is always the case in the talks process, you can agree the less contentious things first, and we're probably at the point now where we're going to need to try to find compromises on the things that are a little bit more contentious. But the objective is to agree a programme for government by the end of next week, and then be in a position to put it to the three parties' memberships over the course of the following 2 weeks, and then form a new government before the end of June and be able to pass that necessary legislation before the 1st of July. But there is many a slip between cup and lip, but I can guarantee you that everyone's working really hard on this. Certainly the parties that are serious about being involved in government are working very hard.
Taoiseach, just on the issue of the schools, there's been a lot of talk about the 2 metre social distancing rule. When the kids go back to school at the end of August, will that social distancing rule be reduced to 1 metre? And secondly, I suppose there's a lot of political talk, be it government formation or pandemic planning. Do you think that the Dáil should continue its work throughout the summer without any break up until September? And Minister Zappone, just on the issue of childcare, we're talking a lot about increased costs for providers, and I know you did address that perhaps increased costs to providers might actually be passed on to increased cost for parents, and I think you did mention that you would like to see some sort of, be it subsidy or grant for parents to fill that gap, because when things get back up and running, the costs are going to be mounting for parents in terms of whether they're going to be able to afford to actually put their child in childcare, because the numbers will obviously perhaps be reduced and the costs will be a lot higher.
Yeah, I think on the issue of physical distancing, as Minister Zappone has pointed out, it's understood by all of us, including the public health experts, that young children under 12, it's not really practical for them to keep 2 metres or even 1 metre apart at all times. And that's why the move is towards a play pod or pod type system where you would limit the number of interactions between kids, so that that's, if you like, an alternative to physical and social distancing where it's not possible because we're dealing with young children. In terms of any change from 2 metres to 1 metre, it's too soon for that. The virus would need to be suppressed much more in the community. We need to see numbers improving for a longer period than so far for us to change that guidance. I know different health authorities give different advice. Some say 1 metre, some say 1.5, some say 2. But what everyone agrees on is that 2 is safer than 1.5 and 1.5 is safer than 1. And it's not safe, in my view and the view of the Chief Medical Officer in the government, to change that guidance now. We would need to see the number of new cases and the power and strength of the virus fall further before it's safe to do so. On the Dáil, look, it's impossible for me to say. I think everyone in the country is going to want to take their annual leave at some point, including politicians, and notwithstanding the very strange political scenario we've seen for the past 4 months, I can guarantee you that TDs and senators from government and opposition have been working very hard. I certainly don't think it'll be possible to have the summer recess start in mid-July, which would be the norm. If we can form a new government by the end of June, that new government will have some work to do in July, not least dealing with COVID, but also legislation that needs to be passed. So, I don't anticipate a summer recess happening in the middle of July as it would happen as normal. So, but we will have to find some arrangements to allow people to take annual leave, because I don't think we could run straight through to the end of the year.
I think that we're very committed to finding a way to ensure sustainability, and again, my colleague Minister Donohoe worked with me closely in devising that temporary wage childcare subsidy scheme that 85% of our providers signed up to in order to ensure that they would reopen and be sustainable. And I think that was a really strong signal to the sector, but especially to families, that we want to support that. Clearly, we're at a different point. We want to maintain, I suppose, generally those principles. We're at a different point. We will begin in the reopening, though, with reduced numbers, probably, of children returning, because, as I already indicated, in terms of capacity and also demand, many parents may be just waiting a little bit longer to bring their children back, or that they hadn't planned to do that earlier on. So, especially in the first couple of months. But I think what I'm committed to is that we don't want to pass that a gap in terms of fees or income, rather, or sustainability, whatever way you want to call it, onto the parents. And providers, I don't think, should open to go into debt, and certainly we need to support our staff in order to return. So that's what needs to be worked on. It's going to be a challenge. There's lots of aspects of that, but I suppose that's the approach that I want to take.
I should preface that question by acknowledging that all of you and the press corps and the Pal corps have been working very hard for the past couple of weeks too. Yeah, so I imagine you'll be keen to have some opportunity for annual leave this summer if it's possible. So we'll bear that in mind as well.
Minister Zappone, the creches are due to reopen on June 29th for the children of essential workers. Have those essential workers been defined yet? Who are they? Are they healthcare workers, or is it broader than that? And on the creches as well, for Minister Donohoe, Sinn Féin are suggesting that the temporary wage subsidy scheme be extended for childcare workers to the end of the year. They say it'll cost about €300 million. Is that an option being considered? Is it feasible? And for the Taoiseach, you mentioned earlier that the hard deadline of the end of June is required for the government talks, but that the alternatives would be difficult. What are the alternatives? Would you set them out? Are they essentially an election? And on Brexit, if we do have a no trade deal Brexit, what are the steps Ireland can take to mitigate the threat of that, given the coronavirus and the impact on the economy?
So firstly, to deal with the temporary wage subsidy scheme, it is far too early to be able to form a view regarding what how the wage subsidy scheme would continue, and if it does continue, what the nature of it will be. And the reason for that is we're not seeing just one economy open up. Inside that one economy opening up are many, many different sectors that are reopening at different speeds and with different needs. And what I'm going to be doing across the coming weeks is doing two things. The first one is, in conjunction with government in the coming days, make a decision in relation to whether the wage subsidy scheme as it is currently structured will continue beyond its current end date. And the Taoiseach and I have indicated on a number of occasions that it is likely to be extended beyond its current end date. And then secondly, when we have more information regarding how different parts of our economy are responding back to that wage subsidy scheme, and we can learn more about how similar schemes to this one act in other economies, the government may make some decisions in relation to the future of that scheme. It is one of these interventions that we've put in place that has made a simply massive difference to over 400,000 citizens still having a job. And the companies and the organisations that they're working for are trying to find their feet again in a really uncertain environment, and we're conscious of that. And we want to make sure that, as with other decisions that we have to make, that if we can change the scheme, the savings we get back from changing the scheme are genuine. It'd be a hollow victory if we change the scheme and then find out that people who were on the scheme lose their job and move right onto the live register. And we're doing a lot of work at the moment to try and inform that decision. And then just briefly on Brexit, just to comment on that if I may, what the government will be doing, and we discussed this in Cabinet this morning, is looking at how we can use the time, particularly across June and July, to offer guidance to companies regarding what we think could happen in 2021 and how we will try and support them in getting ready and trying to get Brexit ready. There's an awful lot going on in the Irish economy. We're all grappling with the harsh consequences of Brexit. The number one priority for so many of us from an economic point of view is to get people back to work, get companies open again, get them employing their employees again. And we're really conscious that to add Brexit on top of that agenda is really demanding. We really understand that as companies are getting up and running again, to remind them of the challenge of Brexit is a really big ask. And the Taoiseach, myself and Minister Humphreys will continue to work closely together to see what guidance and what support we can offer to help companies get ready for that challenge. But no matter what the challenge, this government has absolute confidence that the Irish economy will respond back to that challenge, will get people back to work and will be able to recover. And this government and the next government will work night and day to give the help that we can to make sure that happens.
Yeah, just to answer your question, Cormac, I really don't want to speculate on alternatives because I'm not planning for them. All the work we're doing is focused on agreeing a programme for government, one that is core to the values and principles of my party, but can also gain the acceptance of the Fianna Fáil party and the Green Party, and then to secure ratification of that by our members. And I believe it's possible to do that before the end of June, have a new government in place before we need one.
Can I say, Cormac, thank you. I think as a government, we have been wholeheartedly committed to essential workers, our healthcare workers. The essential workers, as you know, there's a long list of those in gov.ie, so that is true. At the same time, I am also saying, I think from the perspective of children, that as I mentioned earlier, that we're recommending that as far as possible, that the children can return to their pre-COVID early education and childcare centre. Familiar faces, familiar places. That's what's good for children. But if there are more children that need childcare places than are available, we're asking providers, as I indicated, to determine that locally and to prioritize children who were already in their service by parents who are health and social care workers or other frontline workers or childcare practitioners. So we take this into account. Sorry? The list of essential workers, I think, is included, exactly. So that is our approach, while also taking into account the needs and the concerns of the children in order to be able to return to their familiar setting. Yeah.
Childcare providers are saying that they need financial assistance for cash flow to get back into operation and won't be able to do it at all. Can you offer a commitment today that this sort of financial support will be provided?
One of the things I can say is that the program support payments that we provide to childcare workers are being paid in June, and we hope and expect that that can be some working capital to enable them to use for the reopening of their centres. We're also aware, though, that they may require additional monies, and we're working on a potentially for some capital grants in order to support them in that way.
We've seen from the take-up in the wage subsidy scheme of childcare providers that it's around 13% haven't signed up, which would be indicative that they may not reopen again. In a survey last week, 9 out of 10 providers said that they were concerned about their ability to reopen. Have you done any scenario planning around the levels that we might see in terms of providers who can't reopen, and what contingency plans are in place to deal with that if there are a large amount of numbers who can't reopen? To the Taoiseach, so on the front page of the Irish Independent today about an agreement in government formation talks about a payment to parents for childcare. Can you confirm that? And finally, the public sector pay deal is going to go ahead. How can you say to people who are sitting at home worried that their COVID or their pandemic payment might be tapered off, that it's okay for ministers to get a pay increase at this time?
Okay, well, first of all, I can confirm that no such agreement has been made in relation to childcare, and when it comes to the programme for government, nothing has been agreed until everything is agreed. In relation to pay rises, ministers will not be accepting that pay rise. We haven't accepted any pay rises for many years now, and I've already signed the document handing back, I think it's 10 or 12% of my salary this year. Didn't make a big deal of it, but that's something that we've been doing for a very long time now. When this government came to office, we took a voluntary pay cut, and we've been refusing every pay increase since, and that means we hand back an ever-increasing proportion of our salary each year. So I think it's about 12% this year, and we've already signed the documents refusing that pay increase in October, so we won't be taking it.
Just to say, of course, as I said before, very aware of the sustainability issues. 85% of the childcare providers did sign up, 15% didn't, but we've only had 7 childcare organizations closed down that TUSLA has advised us of. We have surveyed parents, as I said, so we know that initially the demand will probably be down, and we're doing an extensive survey of providers now, and that we expect will be finished by the middle of next week throughout the country in order to ascertain really some of their concerns in terms of whether they're funding or what they need in relation to the reopening. And even though, as I said, I've had extensive consultations with the representatives already.
Level of state intervention that it's possible to save some providers in this sector if needs be.
Minister Donohoe has been a great partner with me in terms of, I think, really increasing significant investment in the childcare sector over the last 4 years, 141%. So I would expect, at the very least, nothing less. And I'm also aware of the fact, in terms of, as you all are, discussions that are going on in terms of the next government. And in some ways, I hope and expect maybe some of that will influence what we have to decide before that happens. We're doing the work now. Within the next week, I've already identified we needed to have the public health guidance in order to help us determine capacity issues, out of which then we can begin to develop and finalize the funding model.
I think in fairness to Minister Donohoe, we should always remember, and all ministers always remember, that the money that we spend is actually taxpayers' money, and the money that we borrow on behalf of taxpayers is money that taxpayers and future taxpayers have to repay.